So now we're going to have an overview of upadacitinib global safety data profiles across all rheumatology indications: rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. I'm then going to present the first part of this presentation and then hand over to Professor Oster, who will take us through the second half. These are my disclaimers, and these are my disclosures. As I mentioned in that introductory slide, what we're going to be doing is taking an overview of an integrated safety analysis across all of the upadacitinib trial development programs. So I think before we do that, it's really helpful to stop and just see the extent of those trial programs and where these data come from. And I'll try and explain that to you as I go through the next few slides. In navy blue on the left-hand side are the rheumatoid arthritis select trial programs. And you'll see here the numbers involved in each of these different trial programs and the duration of follow-up. And so from a rheumatoid arthritis perspective, the safety data comes from up to 4.5 years worth of follow-up. If you draw your eye to the middle and look at the pale blue trial programs, these are the psoriatic arthritis select trial programs with over 1,700 patients in select PSA1 and 642 patients in select PSA2. And that safety data follows a 3-year follow-up period. And then finally, the AS trial program with 2 years worth of follow-up for 187 patients in the select AXIS trial program. And we'll be pooling all of these data together as we look at the safety of upadacitinib across these different rheumatology disease indications. But in summary, if we take all of those data together, it's 8,500 patient years worth of follow-up, particularly focusing on upadacitinib 15 milligrams. And that's in 4,298 patients with a good global representation. We do accept, I think, don't we, that patients are slightly different with each of these conditions. And so if you look down into these bar graphs, you'll see exactly which treatments patients were receiving and how much patient year follow-up they all had. So in the rheumatoid arthritis, we have 7,023 patients year worth of follow-up for 3,209 patients. So we're dealing with really large numbers of people followed up for a good length of time. So let's look at serious adverse events. You're looking in, we're going to keep the color theme so it's easy for you to follow all the way through, but navy blue for rheumatoid arthritis, pale blue for psoriatic arthritis, and that pale gray for ankylosing spondylitis. And here we're looking at serious adverse events, and you'll see that the rates of serious adverse events were similar with upadacitinib 15 milligrams as they were with methotrexate monotherapy or adalimumab for patients with RA or PSA. And the rates of serious adverse events in the select AXIS 1 trial were low. And I think we have to accept these were followed up just for 2 years and a smaller number of patients, 182 included in this analysis here. But really, I think reassuring data on rates of adverse events being similar with upadacitinib to other therapeutic options here. So what about deaths? And here we're looking at all deaths which have been adjudicated in the trial program. There's a couple of things that I want to point out here. First is that the rate of all deaths in patients with RA and PSA receiving upadacitinib was similar with those receiving methotrexate monotherapy or adalimumab. They were not higher than you would expect in general populations. And I think that's a really important thing to hold on to. So reassuring data that we're not seeing a signal here for, certainly in the trial program, for excess deaths with standardized mortality ratios of 0.51 and 0.14 in RA and psoriatic arthritis, respectively. There were no deaths in the AS follow-up. What about infections? Well, these are serious infections, and you'll see that the rates of serious infection were generally similar across all of the treatment groups in RA, PSA, and AS. Pneumonia was the most common serious infection in RA and AS. And there were no serious infections reported in select AXIS 1. Let's talk about herpes zoster. I think this is an important adverse event, and it's one that you may be expected to be slightly higher with JAK inhibition. And in fact, that's what we've seen. So herpes zoster was more common with upadacitinib compared with adalimumab or methotrexate in the RA and PSA trials. But I think important to note that most herpes zoster events were non-serious and only involved a single dermatome. When we think about herpes zoster, we worry about ophthalmic involvement, and that was reported in 13 cases of rheumatoid arthritis and 1 with PSA, but no cases reported in the AS study. Obviously, if somebody develops herpes zoster, we would interrupt the therapy, give standard treatment until symptoms resolved. With that, I'm going to hand over to Professor Oster, who's going to guide us through malignancy and the other adverse events.